Hello, it's Matt Cash, lymphedema therapist with Lily Clinic in Roanoke, Virginia. And if you're frustrated, I'm frustrated. Most of the comments I get on my videos are, my doctor ignores me. They're not listening to me. They're telling me there's nothing that can be done. Well, that's not true. Why are they doing that? Well, they're doing it because they're not taught this in medical school. Why? I have absolutely no idea. According to the World Health Organization, venous disease, which is the primary cause of lymphedema in the lower extremities, venous disease is going to be significantly on the rise because the baby boomers are aging. And with age comes bad veins. And with bad veins comes lymphedema. So this condition that a lot of people are suffering with, more people are going to start suffering. So how do we help this situation? Awareness, which I've been screaming awareness, because awareness truly matters. So what can you do? If your doctor's saying there's nothing that can be done, and if your diuretic is not working, your Lasix, your furosemide, if that's not working, it won't on lymphedema, it's not. If that's not working, and elevation is not working, then it's not a heart issue, and it's not simple edema, it's something more going on, perhaps lymphedema. So maybe say to your doctor, hey doc, the pill's not working, elevation ain't working, you're telling me I should just live with it, but it's my understanding that there's a condition called lymphedema, which is a swelling condition that in a lot of cases is because of bad veins. If it's cancer related, you're usually with the provider who understands it. But unfortunately, there's a lot of physicians that say, oh, your ankles are swollen, let's put you on a diuretic, you'll be okay, elevate your feet. It doesn't work for lymphedema, right? I could scream it all day. So how do we change this awareness? I think we have to actually go to the source. What is the source? Well, if you're watching me, you're aware of lymphedema. Where can you get more information on lymphedema? I talk about it all the time. There's a lot of wonderful agencies, associations, the National Lymphedema Network, Lymphology Association North America, Learn. There's a lot of frameworks. There's the British framework, there's the Canadian framework. It goes on and on and on. There's a lot of research. The information is actually there. The problem is it needs to be presented on a silver plate to providers. So you could say to your physician, your nurse, whoever it is who might be dismissing you, because that's what I'm getting a lot. And I am not saying that's not happening. I know that's happening. I've watched a physician say lymphedema is not a real thing, and I'm like, it is a real thing. So how do you treat it? Complete decongestive therapy. So if your doctor's like, no, I don't think so, say, hey, I think there's a condition. Actually, I know there's a condition called lymphedema. I think I have it because your diuretic's not working, elevation isn't working, something else is going on. I don't have any heart issues, so why am I having swelling? And boy, I got these varicose veins and spider veins. It's a sign. It's a sign. So if we're able to take information to our provider and say, I think I have lymphedema, the gold standard treatment is complete decongestive therapy. Are you aware of that? If they say no, then they need to be educated. And if they refuse, perhaps, and I know our healthcare system is really, honestly, it's garbage. It's such garbage right now. I don't want to get on that, but it's garbage. People can't even find a primary care physician. It's horrible. It's horrible. But if we're going to have any change whatsoever, it's not going to come from the top. The top does not care. They're making money. They do not care. If we want change in healthcare, and specifically lymphedema, it's got to come from the people on the ground that says, hey, I have a condition. There's a gold standard treatment. There's lots of education. Just because you don't know about it doesn't mean it doesn't exist. Here's some information. Can you please send a referral to a therapist who understands this and can treat me with complete decongestive therapy? What is complete decongestive therapy? Step 1, decongest the limb. Step 2, maintain. Phase 1, decongest. We do that through short stretch bandage application. We do it through tissue work. We do it through fibrosis reduction. There's a lot of strategies. And then we want to maintain. We also incorporate meticulous skin care. Skin care is vital. Tissue work is vital. Using pneumatic compression devices appropriate is vital. Exercise is vital. There's a lot of components to complete decongestive therapy, well documented. Once you're decongested, you maintain with compression, not before. If your doctor wants to put you in compression when you're swollen, they don't know what they're talking about, and they just need more education. Never should you be put in compression while you're swollen. The idea of compression is to maintain the reduction that occurred during complete decongestive therapy. Awareness It matters. It truly matters. My frog understands. It's so cute.